I'm here to speak to you all about a profession that is in high demand, but has one of the largest shortages than any other. Nursing is a profession that has one of the largest shortages. Nursing is a profession that has been admired and respected throughout the world for many years. However, in the United States, there has been a shortage of nurses for years. Some of you are not aware because you are not medical professionals. More so, most of you that are in the field would say Most of you that are not in the field would say your field of profession has a shortage. Salary, working conditions, and lack of staffing has plagued the nursing profession in the 20th century. In my world of nursing over the past 10 years, I have seen a decline in the geriatric, doctor's office, and hospital settings. This is only 5% of the entities that nurses work in. However, there are many more entities that suffer the same. Despite all the uproar in the news over the nursing shortages, there are many influences that contribute to this. For example, according to the online nursingdegree.org, an ICU nurse complained that a patient had been on the unit for 10 days and she has not been able to give or shave her patient a bath because of the additional patients she was assigned, preventing her from being able to care for her patients properly. Many nurses have shied away from nursing due to being overworked because of staffing shortages, poor working conditions, and most of all, low wages. Working on specialty units like ICU require one-on-one care. However, nurses are now being assigned 3 to 4 patients at a time. As a nurse who worked on the cardiac unit taking care of cardiac patients with lower acuities, but was often assigned patients with higher acuities because of the shortage of critical care nurses throughout the hospital. Charge nurses and house supervisors often have to take group of patients for an entire shift. Nurses all over the hospital that I worked at continually complained to administration at open forum during monthly staff meetings. The morale at this hospital has plummeted because of lack of available supervision throughout the hospital during the staffing crisis. Many nurses at this hospital has resigned or transferred to non-direct patient care areas. As we all know, competitive wages for nursing has been another reason why there is a nursing shortage in different entities of nursing. We all know salaries play a big part in retaining staff in any profession. More so, people tend to seek out employers with the highest salary. As a nurse, I have always sought out for nursing jobs in my specialty of care that paid more. I personally believe that nurses receiving lower wages don't deliver the best care because they are usually angry, which creates a hostile work environment that leads to patient safety. I do know that employers that have unions are usually fully staffed because unions advocate for fair and competitive wages. Fair wages has always been the driving force to employee retention, patient safety, and increasing the morale within a facility. Along with other dissatisfiers that come along with the nursing profession, poor working conditions has caused nurses to contract diseases within many facilities, from hospitals, nursing homes, and doctor's offices. According to the Center for Disease Control and Prevention, nurses' working conditions has been associated with medication errors and falls, increased death, and spread of infection. Needle sticks in the facility where I'm employed has a high incidence among nurses because of inadequate needle delivery systems. Also, common colds and flu symptoms has a high incidence as well. Remember, some infections within the workplace is not spread by poor working conditions but lack of patient education. Patients have been unknown to transmit MRSA, C. diff, and common cold to staff and other patients due to lack of hand washing. As I conclude, I want all of you to know that nursing has been a passion of mine ever since I was a kid. I will continue to advocate for fair and competitive wages for all nurses. The endeavors of nursing have entreated many and inspired many to be the best nurses they can be. However, there are many deficits this profession suffers today. Poor working conditions, poor wages, and staffing has discouraged members of society from going into the nursing profession. Nurses are sharing their Nurses are changing their profession daily because of these conditions. However, as nursing organizations, along with other organizations, continue to advocate for nurses and challenge the labor board, this profession has potential to recover. Thank you all.